The opioid epidemic continues to be a serious problem in this country and locally in the state of Wisconsin. Last time we were at Upland Hills Health more than a year ago, we talked about it, but there have been some changes even since then. We're going to talk about those changes, plus we'll learn a little bit about how to recognize if somebody is acutely or chronically abusing opioids in your life, plus what is being done about it here in Iowa County. My guests will include Dr. Charles Pierce, Madison Emergency Physician, and Dr. Joseph Hansen, Medical Director of Upland Hills Health Emergency Department, also a Madison Emergency Physician. From Upland Hills Health here in Dodgeville, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Upland Hills Health in Dodgeville, and we're discussing a rather serious issue that we've talked about before on this program, but it's always good to keep information updated, the opioid epidemic. And I'm joined now by Dr. Joseph Hansen and Dr. Charlie Pierce. Thank you so much for joining us.
Good to have you.
Thanks for allowing us into your space here. It's good to be back. So let's talk a little bit first about what exactly is the opioid epidemic for those of our viewers who are unfamiliar.
In general, the opioid epidemic really just refers to the increasing abuse of certain medications and street substances, particularly refers to the prescription drugs like oxycodone and hydrocodone, and then more street drugs like heroin and fentanyl. And it's led to a really significant and scary rise in overdoses and abuse of these medications, and it's really devastated a lot of lives.
And what is the difference between, because I've heard, we were talking a little bit before the show started about the difference between opioid and opiate. Is there a difference between the two? Can they be used interchangeably?
Yeah, so opiates is really a blanket term now.
Mm-hmm.
If you really want to go back in the definitions, opioids used to refer to a synthetic substance that mimics opiates, which is opiates is really derived from, you go all the way back to opium. Okay. So that's the real distinction between the two. And the third player in that is narcotics, and that really has a legal connotation. But nowadays we really use opiates really, like I said, as a blanket term to encompass all this type of medications and illegal substances like heroin as well.
Absolutely. So, obviously we've done a show, we did actually a two-part series a couple years back about the opioid epidemic. What has changed since doing that show 2 years ago?
Yeah, I think it was really important to get the word out at that time, and there's been a lot that's changed. Some good. It would be nice if we had some more progress.
Right.
The rate of overdoses continues to increase,
mm-hmm.
And increase in terms of overdose deaths as well. To the tune of last year, about 64,000 people died.
Wow.
And nationwide, it's averaging about 115 overdoses per day. So it's devastating a lot of lives. What has changed is the medical community has responded by really limiting the number of prescriptions that are written for folks to take these, both for long-term and in terms of acute pain. What's resulted, though, is an increase in the rise of the more street drugs or narcotics, heroin, fentanyl that folks are abusing. Those doses are less predictable. If you had a pill, you'd know it's so many milligrams. But when these are street medications, people don't know what they're cut with, and it's led to a really significant rise in the overdose rate.
So it sounds like you said overdoses are down when it comes to the prescription end of things?
Well, overdoses as a whole are up. There's a little sort of interesting demographic shift in terms of overdoses for elderly are continuing to increase from the prescription medications, but the young people are continuing to die at alarming rates of heroin. But the number of prescriptions that are written by physicians overall is down, and that's, I think, a positive trend.
This is a really serious issue that we're discussing today. What are some of the implications? Why is it really so dangerous?
Well, I think, as Joe pointed out, the biggest thing, and this is a sad fact, is we hit kind of a big gate we went through a number of years ago where unintentional overdoses actually surpassed, not only nationwide, but in the state of Wisconsin, surpassed the number of deaths that you see from automobile accidents. So that's staggering. On Labor Day weekend, Memorial Day weekend, you're driving down the road, you see the big sign that kind of gives you the count of how many deaths you have. You now know when you look at that sign, we have now more unintentional overdoses in Wisconsin and the nation as a whole due to opiates. So, this has become, unfortunately, over the last really 15 years, it's been a staggering increase. And with, as Joe pointed out, this increased rise that we're seeing now of street drug use, that's led to more unpredictability of what people are using, and thus an increased rate of death on top of that.
Wow, scary stuff. We got to take a short break. When we come back, we're going to talk a little bit about some positive things that are happening here in southern Wisconsin. Don't go away. We'll be back with more Wisconsin doctors here at Upland Hills Health. We've been discussing the opioid epidemic here on Wisconsin Doctors at Upland Hills Health. We talked a little bit about what it is and how it's changed in the past few years, what the shift has been. But let's talk a little bit about some solutions to the problem, because we want to obviously try to keep it positive here. What exactly can be done? We talked a little bit before this segment about how there's really kind of three arms of things that can be done: prevention, intervention, and treatment. Let's talk a little bit first about prevention. What can we do to sort of prevent people from getting hooked on these drugs?
So one of the things that the medical community has done is really undo what was a big harm. In the 90s, there was a lot of discussion about how these medicines are safe, and the companies that produced them really marketed them to physicians as safe for long-term use. Whereas before, it was really a lot of fear that they were going to be as addictive as they turned out to be. Well, we've realized that they are addictive and have destroyed a lot of lives. So we've educated a lot of physicians in terms of prescribing patterns and what's appropriate. We've created a database statewide, and it's actually in a consortium with a number of other states, where you can look up and see, has a patient received other controlled substances recently? And it's actually a state law that we look at that database before we prescribe any of these medications. So along with decreasing the rate of prescriptions, we've just increased awareness for families that these are dangerous medicines. And then obviously the police forces are working on the more street drugs and the drugs of abuse like heroin and fentanyl that we discussed.
So from the medical community standpoint, they're really doing a lot to try to keep as many of those drugs out of the hands of people as possible, and only prescribe it when absolutely necessary.
And those folks who do need them chronically are really monitored closely by physicians who do a lot of prescribing of these medications.
Yeah, absolutely. Let's talk a little bit about intervention. When somebody is at that point where they've potentially overdosed or something like that, what can be done?
Well, I think there's one thing you want to kind of break that down into different types of intervention. So if a person is overdosed or has overdosed, and certainly calling 911 is absolutely the right thing to do. Because there's a reversal agent out there, something called Narcan, and that's a medication that can be given in the nose or can give injected that will help reverse the effects of these opiate medications and take that person out of being acutely, life-threatening or in the threat of life. And that's the one kind of essential intervention we have. And the state of Wisconsin has really worked and been really progressive. And I'd say, really, we're top of the pile in terms of trying to find ways to intervene and trying to find ways to address this problem. But the state of Wisconsin has made it so that pharmacies can actually prescribe this medication without needing a written prescription, so they can sell this Narcan over the counter, where the pharmacist will teach individuals how to use it. And so that's been one big intervention to get that medication out there. And then also been working, like Joe has been working with the police force here in Iowa County, as well as a lot of pre-hospital providers like EMTs, so that they can have that medication in their hands, because oftentimes police will be the first one on scene for an overdose, and so they'll be able to administer that medication. And the police forces within Iowa County have saved numerous lives. I mean, numerous lives that they've saved simply through that intervention. So that's kind of the biggest acute intervention that we see. From a bigger picture intervention standpoint, we statewide, as well as within this county, are working to increase the number of resources we have for people with addiction issues, increase halfway housing for individuals, as well as, and something we could probably get into, talk further about, is use of drug courts to try to help keep people out of incarceration and have them stay out of incarceration and stay sober.
Wow, drug courts. That's a relatively new thing. Let's talk treatment. We've just got a few seconds left, but let's at least start to talk about treatment a little bit, because there's acute and chronic treatment, or treatment for acute and chronic abusers. So let's talk a little bit about that.
So in the acute phase, really one of the things these medicines do is take away the body's drive to breathe. I think last time we did this segment, I said the body loves these drugs more than it loves oxygen. So these patients just don't breathe. So simple, basic life support things like mouth-to-mouth can help them, and then these reversal agents can be given. One of the things I think it's really important to drive home, though, if at home you give one of these medications, your family member still needs to come to the emergency department, because sometimes the drug that they took will outlast the reversal agent, so they could go back into the spiral of not breathing again.
Yeah, so make sure that you're checking into the hospital, even if you've taken the Narcan. Narcan?
Narcan.
That's the brand name.
Narcan.
And I'd recommend they just call 911. But if they're not comfortable with that, they should drive here. And there are laws to protect anyone who brings a family member to the hospital. Even if they were involved in the drug use, they're protected in a Good Samaritan law because they assisted them.
We got to take a short break. When we come back, we're going to talk about how to recognize if somebody might be using or abusing that you know in your life. We'll be right back here at Upland Hills Health. Back here at Upland Hills Health talking about the opioid epidemic. We talked a little bit about what's changed in the last couple of years and what's being done. And now we're going to talk a little bit about recognizing. But before we do that, I want to make sure, because we didn't get a chance to talk about this in the last segment, we talked about acute treatment or treatment for acute abuse of these types of drugs. What about chronic? What can we do? How can we treat people who are chronic abusers of this?
So I think the first thing right off the top is to understand that it's not a moral failing. Addiction is not a moral failing, it's a disease process.
Right.
And so I think the big part of getting over and getting into chronic treatment is making that recognition that this is really a disease. And so you need to approach this disease like you would any other disease. And so there are various treatment options that you have out there. The ones that are clearly effective is going to be counseling. So finding a counselor that can help you get through the day-to-day as well as get out to the 90-day of sobriety. And those counselors can be professional counselors, but certainly NA, so Narcotics Anonymous is huge. The other options are working with your physician. So you can work with your physician or clinician, and they can help you get on substitute therapy, so other medications that can kind of help quell the desire that a person has to use or abuse. And the other thing, you can have agents like that Narcan we talked about that a person can take on a chronic basis that keeps, again, blocking those receptors so a person doesn't have that desire to go out and use. And then there's other things that are being started in the state of Wisconsin as well as Iowa County to try to work for halfway houses and sober houses to help support folks in a 360-degree way so that you're kind of wraparound services to protect them in all different aspects of their life.
So what kind of symptoms are you guys seeing, both acute and chronic, in the emergency room or in your office?
So acutely, what you'll notice is essentially the patient is not breathing. I mean, if they're breathing at all, it'll be sort of sonorous, sound like they're snoring. Often they turn blue, and then they just sort of stop all respiratory efforts. They will look like they're asleep, or, for lack of a better way to explain it, like they're dead. So that's when you need to intervene, and it's important to do CPR or things if you're comfortable with it. Call 911 or use that Narcan antidote if you have it. The more chronic use is harder. It's more nuanced, and I think understanding a little bit of the physiology of what these medicines do. First thing, the body just gets habituated to having the medicine. So when you have it, right, you feel normal. But if you don't have it, you start to have withdrawal symptoms. And that really is what drives a lot of the abuse. So people who are chronically using these opiates will have swings in mood. When they're not on the medicine, they will seem very sick, they'll be nauseous, they'll be irritable. When they've just taken a dose, they'll be kind of euphoric, and the mood will be a little more labile. Depending where they're at in that whole process, if they're just dependent and not abusing, that might be it. But when they go into the realm of abuse, then you start to really see a lot of psychosocial strains, missing work, stealing things. Social relationships will really start to fall apart.
Yeah, a lot of serious issues. What are some things families should be looking for to recognize opioid abuse?
Yeah, so as Joe points out, certainly you want to look for these changes in behavior. So some degree of which person's going to be isolating themselves, some degree we see some mood lability, so that the fact they'll just be kind of not their usual self in some ways. The other thing really you want to look for in the setting of abuse is if a person's on chronic medications, and you see that if you're their caregiver, for instance, or at least you're intimately aware of what the medications they're taking, if they're taking escalating doses, so if they're running out of medications sooner than they ought to be, that's a big red flag that person may be using those medications in a way that's not appropriate, or in a way that's not as prescribed.
This next question comes from more of like thinking of chronic users. What should people do if they suspect one of their loved ones is a chronic abuser? Maybe nothing in the immediate now that's a problem, but they suspect that there might be something wrong.
I think, obviously,
who should they call first, I
depends
guess?
on the relationship. I think the first thing really is to bring it up with
Right.
the person that you're worried about. It's not going to be an easy conversation
Right.
because there might be quite a bit of denial regarding that. And then if it's something that's being prescribed by a provider, I would see if you can go to the next appointment with that patient and talk to the provider about it. As physicians, we can't talk about our patients without
Right.
their permission, but if you could go to that appointment, that would be helpful. There are a lot of resources, and Dr. Pierce has worked a lot in Iowa County and can speak to some of those that are available here.
Yeah, absolutely. Did you want to speak about some of those right now?
I think we'll get
We'll
back to
save it.
Yeah,
We'll save it
yeah.
because we got to take a break here. But when we come back, we're going to talk a little bit about some of the folks that are most vulnerable to these addictions. We'll be right back with more Wisconsin Doctors. We're back with Wisconsin Doctors here at Upland Hills Health. We've been discussing the opioid epidemic. And during the break, we were talking a little bit about how there are certain populations that are more vulnerable to an acute overdose and certain populations that are more vulnerable to the chronic abuse. And they're really almost two separate populations. Can you talk a little bit about what those two populations look like?
So the acute overdoses we often see in people who are new to a medication or a drug, kids,
Sure.
and then other people who maybe had been using, and this is more in the heroin fentanyl world. They had been using for a while and then had stopped, and then they come back and try to go back to their dose that they used to think that they needed, and then they take too much. I mean, I should start by saying these drugs are never safe. I mean, these are
Right.
not things that should ever
Right.
really be abused.
Right.
In terms of the chronic use, really, the fact that these medicines are so addictive, anybody is at risk. If you take them long enough, you're going to develop some physiologic dependence on the
Right.
medicine. And then people who are in difficult socioeconomic straits or have difficult psychological issues, they're at more risk of abuse of substances in general. So certainly they are at more risk. But I think it's really important that people realize that anyone can fall into this trap.
Yeah, very important to realize that nobody is absolved from having
Right.
problems with that. So let's talk a little bit about some resources, because we talked in an earlier segment about drug courts, and then we also mentioned a little bit about some things happening here in Iowa County. What are some things specifically that are being done in Iowa County about this problem?
Sure. So the first thing I'm glad you highlighted too is drug courts. So
Yeah.
to take a step back and what is a drug court? Basically, the idea that came about and shown to be really successful is to say, instead of taking a person who is arrested for a nonviolent, I should point out, nonviolent drug-related crime, instead of incarcerating that person where they're not going to get treatment, where they're not necessarily going to come out to be a productive citizen, where you're not really going to address that fundamental addiction, remember that disease model of addiction. Instead of putting those persons through the usual court system, they've created something called a drug court. And what a drug court is, and Iowa County's really been successful with it, is that they create a court system that selectively chooses individuals who get arrested for one of these drug-related crime. And instead of sending them to jail or on to prison, the court system will work with them to put them through a treatment program. It's a phased-out treatment program, and it's really intensive. And these folks are really held to almost a one-on-one relationship they have with the judge that keeps them at task on a monthly meeting basis with the judge, but also in the court itself, but also with a variety of other kind of stepping stones that they have to go through before they can get themselves out of that system. And if they violate it it is punitive, so it is have the backing of the law as well. But it's shown to be really successful, A, to keep people out of prison, but B, to get people sober and keep the recidivism down. So that's been a big and important step that Iowa County's been really progressive with, and Wisconsin in general has been pretty progressive with. And the state of Wisconsin has put quite a bit of money and resources towards the creation and use of drug courts within our state. But Iowa County's done above and beyond that. About 2 years ago now, we put together a task force, an opiate task force, where we took all the kind of stakeholders in the different aspects, because this is, remember we talked about this, you really want to have wraparound services and address all the different aspects of an individual's life who's abusing opiates. And so this task force is worked with the counselors, the hospital, a number of the providers in the community, as well as law enforcement, to try to develop an ongoing development process to try to create an environment where we can not only prevent and treat and intervene, but make it in a way that's sustainable going forward. And in that vein, Southwest CAP has actually was able to obtain a grant that is going to allow us to, in Iowa County, build sober houses, so individuals can have a place where they live, where they're going through treatment, where they're trying to achieve sobriety, because that has proven to be also a really successful model. And part of that grant, which is going to be something that I'm really excited about here in the emergency department, is we're working with recovery coaches. So these are individuals who really will act as mentors and will come to the hospital when a person has an acute overdose or has opiate-related concerns like withdrawal, coming off the medications. And they will help not only tap this individual into the resources that are out there and that we're working on and building, but also be a mentor and help a person walk through the different stages of recovery.
Wow, we are out of time. We could talk for another 5 minutes at least on this, but we're out of time, unfortunately. I want to thank my guests, Dr. Joseph Hansen and Dr. Charlie Pierce. Thank you so much for being with us today. Thank you to all of our viewers, and from all of us here at Upland Hills Health and Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.